Hi all. I have created a study guide for you all for Unit 2 since we will not have any classroom time to deal with the surgical patients part of this unit. I do want to emphasize that if you have any questions or something is unclear, please be sure to contact me and we can talk about it. So I'm just providing you with this recording to kind of walk you through, uh, you know, the two chapters to help direct your learning, I guess. So I'm starting with chapter 17, which is the chapter that has to do with surgery. It starts out talking about different reasons for doing surgery. I would think it would be important to understand those and the terminology related to those different types of reasons for doing surgery. They also talk about factors that impact the outcome of surgery. Some of them are very obvious, but some of them may not be as obvious. There's also some terminology. It's listed at the beginning of the chapter, and so these are words that I think are associated with surgery that you need to know. If you scroll down to looking at the pre-op period, I did post a video that relates to assessment and looking at the book, some of the important aspects of this period related to the assessment is determining whether there or not there are any prosthesis, whether or not there are any loose teeth, any allergies, of course medications always, recent food or drink, what their medical history is, what their current vital signs are, and looking at doing a head-to-toe assessment and assessing each of the systems. So, during this period, teaching is also important. Patients will want to know what will be done. This should be explained by the physician. Also, they need to know what to expect. After the surgery, during the surgery, what will they experience? What will they expect? What can they expect to happen? Where will they be? All those kinds of things are important to do some teaching about. There's also very specific activities that nurses are responsible for in terms of preparing the patient for the surgery. There is always a requirement to have an informed consent signed, and so that would be the nurse's responsibility to make sure that that's been done. The doctor is the one that explains the procedure, and then the nurse follows up by making sure that the consent is signed. Assessing whether or not any food or fluid has been taken in a given period of time, then that would be determined by the anesthesiologist. If there's any particular bowel or skin preps, those would be the responsibility of the nurse. Taking care of any personal items, making sure the patient is properly attired for surgery, considering circulatory factors, looking at current meds, what have they taken recently. There are medications that can have a very negative impact on risks during surgery, such as anticoagulants. Usually in the pre-op area there is some form of a checklist to make sure that everything is covered during that period, because it's really, really important and can really impact the patient's well-being. During the surgery, there are different roles, different people involved in the surgery. It's not just the doctor and the patient. There are a lot of different roles, so I would expect you to have some understanding of that. There are also different types of anesthesia. We talked a little bit about this during our maternity section, but I want you to sort of have an understanding of that. And the degree of sedation that patients experience. There's a little video about the surgical safety checklist. This is a initiative that was introduced by the World Health Organization that helps to keep people safe. Remember we talked a little bit about the Joint Commission, and one of the issues with respect to patient safety has to do with that intraoperative period. Looking at what is the nurse's responsibility during the intraoperative period is another important thing. During post-op, there's a really nice table on page 270 of all of the common complications related to surgery. Then there is also a video that sort of demonstrates a post-op assessment, the things that you need to hit. And listed here are, of course, we would be checking vital signs and probably would be doing that more frequently, at least initially. We need to assess their respiratory and their cardiac status. We've talked a little bit about an incentive spirometer and what that is. It's really an important piece of equipment in the post-op period. You're going to be assessing the patient's mental status, their pain level, obviously their skin, and if there is a wound, that is also a huge part of your assessment. Assessing their ability to ambulate and move in the bed. Fluid and electrolytes is important, so assessing and keeping track of I&O. Their diet, and are they able to void? If not, what is the status of that catheter? Let's see here. We also need to be looking at what are nurses going to be doing to help patients recover. In terms of assessment, that ongoing assessment, how are we need to be identifying risks. So what are the risks, and how do we intervene early so as to prevent harm to the patient? Ambulation and ways to promote activity are important. Pain and symptom control, what's important about that. Wound care is also very important. Turning, coughing, deep breathing, and the use of the incentive spirometer help prevent respiratory infections and atelectasis. And what is important to educate patients about, both in the immediate post-op period and also long-term, like before they go home, if they're in the hospital, what do they need to know? So that is kind of in a nutshell chapter 17. And then if we look at, this is chapter 15, has to do with pain, and it talks about all different kinds of pain, but obviously our focus for this unit is acute pain, which is what's associated with surgery. So understanding the characteristics of acute pain, and then also understanding the difference between acute and chronic pain. There's a table on page 216 that would be good to be familiar with. One of the points I want to make is that a lot of times people will make judgments about, or nurses will make judgments about people based on vital signs. If somebody has acute pain, often their vital signs will be different from normal, but that's not necessarily a reliable indicator of acute pain. The most reliable indicator of acute pain is the patient's report of pain. And we also know that with surgery, what your expectation is that the pain, as the patient recovers from the surgery, that pain ideally should diminish over time, and that's different from chronic pain. So, and that's something to assess for. So there is, if you look in the PowerPoint, I've added a slide that is a nice little pain assessment and acronym that will be helpful in just remembering to cover the territory when you're assessing pain. The book talks about 6 steps in terms of how you're managing the pain, acute pain. It also talks about different pain intensity scales. We are used to the 0 through 10 scale, which is useful for most people, but for like children or for people who are nonverbal, there are different scales that can be used to assess pain. So it's important to know about them. And then related to interventions for managing pain, there are both non-pharmacological methods as well as pharmacological. And in the non-pharmacological methods, they have a nice list, but I also would like to point out that positioning is important. Sometimes just repositioning a patient will help them with their pain. And then I have posted a medication list. Most of the meds on that list have to do with pain management. There are a couple other ones that relate to the geriatric section of this unit, but most of them are pain meds. So you can look at that list and try and fill in that grid that I've created for you. I think also important is the concept of tolerance. We mentioned it in 174, but that's an important concept related to pharmacological methods of pain relief. Fear of addiction, why does that relate to the post-op period? Routes of administration of pain medicine, and what is a PCA pump, and what are safety considerations, and what's important to teach patients about using a PCA. And then finally, just looking at what are the side effects, and then how can nurses help to prevent harm related to those side effects. There are other topics in this chapter that we will be covering later. We'll be talking about cancer pain. We'll be talking about adjuvants at another time. So this is, in a nutshell, what I think you need to cover. Again, if you have questions or, uncertainties about anything in either of these 2 chapters, please let me know. Thanks a lot.